District Attorney Andrew Womble said Brown used his car as a, quote, deadly weapon, driving at deputies and putting their lives in danger. District Attorney Andrew Womble said deputies were justified to shoot and kill Andrew Brown because he used his car as a deadly weapon. Protesters say it's worth pointing out in this case that O'Quinn is also accused of using her car as a deadly weapon, but she did not die for that decision.
Now, Commonwealth's Attorney Colin Stolley says the VBTA may have violated Virginia election law. VBTA founder and school board member Laura Hughes said the organization didn't file what it needed to, but that's fixed now. She hung up when we asked for more details.
We had something that we needed to file that we didn't know we needed to file, and it's been rectified. That's it.
What was that you did not file or did not know you needed to file? Confused or skeptical about what you pay for at the hospital? You are not alone. Chesapeake Regional Healthcare said it would be impossible to provide a sample itemized bill because there are, quote, too many variables. After some digging, we found an itemized bill for an uncomplicated childbirth on their website, showing it would cost about $22,000. We followed up and asked Chesapeake Regional to break down some of those costs. A spokeswoman responded and said they are correcting inconsistencies and asked us to disregard the data that is still available on the hospital's website. 4 vaping infractions increased to 40 infractions, which then tripled to 128 last school year. And if you slide to Virginia Beach, the number of students disciplined for vaping boomed from 28 to 174 to 363 in just 3 school years. Armed with 2 number 2 pencils and a calculator, Chris Churko arrived at Princess Anne High School to take the ACT on an early Saturday morning in April. He had studied with a tutor for months, late nights, practice tests.
I'm ready. I'm gonna get this great score, hopefully.
And on test day, he felt confident.
As I'm moving through it, I just feel like I'm killing it.
Chris received a 32, a goal score for him, and one that would open up thousands of dollars in scholarships and new college options. Then about 2 months later, he received this letter from ACT. It reads, "Unfortunately, due to an administrative error and through no fault of your own, your April test scores will be canceled." ACT says an administrator accidentally put Chris in a room that provided extra time for test sections.
I just felt like totally defeated because I really didn't want to study again.
The testing company apologized, offering Chris another chance to take the test for free. But he hadn't studied for months. That's a risk.
If I didn't do as well that time, then I guess that was the score I was going to get. And the opportunities and scholarships, I would have gotten 32 would be out the window.
ACT labels this a misadministration, and the company's policy cancels every score involved to protect the integrity of the test. But how often does this happen? Our 13 News Now investigation confirmed that ACT does track misadministrations each year, but the company chooses not to release numbers or statistics. An ACT spokesman said these cases are rare, but he didn't give information that supports that claim. We pressed ACT. Why not release the statistics and be transparent? They said they won't for security reasons. I asked multiple times, what are those security reasons and what would be at risk if ACT released numbers about misadministrations? I didn't receive a direct answer. National Fair Test advocate Bob Schaefer says this is the problem. He says the testing industry doesn't have to answer to anyone, and these decisions can be life-changing for students.
There's no accountability for those companies' behavior. We don't know how many cases there really are. We assume we see only the tip of the iceberg.
And then there's Dino Churko, Chris's father, a retired New York City firefighter with a strong moral code.
So when you continue to preach to your children that hard work will pay off, and then you see it taken away by someone else's error, it's deflating.
He wants to see his son's score reinstated, saying that Chris earned it.
It makes Chris feel that all the work he's done the right way was meaningless. And so now I have to build him up again to have faith in the system, to have faith that the harder you work, the rewards will be at the end of the road.
Evan Watson, 13 News Now.
They'll be there for 12 o'clock. Yes, ma'am.
Medical Transport LLC provides about 500 ambulance rides each week. It's a non-emergency ambulance service owned by Centera Healthcare for people too weak or sick to travel in a car. A common transport would be for kidney dialysis treatment 3 times a week. From 2011 to 2014, medical transport drivers took thousands of patients to their appointments who didn't need to travel in an ambulance, according to the Department of Justice.
We made an honest mistake for which we paid dearly.
Medical transport staff build taxpayer-funded programs like Medicare and Medicaid for millions of dollars in reimbursements. After a federal investigation and years of legal negotiations, the company settled with the government for $9 million in March of 2018. Spokesman Dale Godding says medical transport simply misinterpreted the rules.
This was an error. This was a mistake. This was a costly lesson, and now we're doing business better and in compliance with all of the Medicare regulations.
Godding says the company now has a new compliance manager and compliance committee. He emphasized the original mistakes did not involve quality care or safety. They just focused on whether a patient was eligible for ambulance transport. Whistleblower attorney Timothy McInnes says the federal government is increasing its pursuit of ambulance billing fraud cases across the country. He says illegal billing hurts taxpayers and everyone who relies on Medicare and Medicaid.
People who use those programs are hurt because there are a limited number of dollars, and if dollars are being used improperly, it's taking it from one thing and using it for something else.
McInnes says a $9 million settlement is significant and one of the largest he's seen. As part of the settlement, medical transport is now being watched closely through a 5-year monitoring program called a corporate integrity agreement. Any new problems, and the company could face harsher punishments. That's where there's a growing concern. A whistleblower sent internal company documents to 13 News Now, showing the company is conducting an internal investigation into physician certification statement forms for its non-emergency patients. This is medical transport's PCS form, commonly used for a doctor to sign off that a patient must be transported by an ambulance. The form is normally only applicable for a limited amount of time. Dale Godding confirmed the company is currently under an active federal investigation by the U.S. Department of Health and Human Services, but he wouldn't provide details.
There is an investigation of one narrow aspect of our operation, and because it is a current investigation, it is a confidential matter until the Office of the Inspector General says that it's not.
Medical transport officials declined to comment on the whistleblower documents. The Office of Inspector General also declined comment on the investigation. We also asked why taxpayers should trust medical transport now, knowing the details of the previous settlement and without any additional information about the current investigation.
We are under more scrutiny than most ambulance companies in the Commonwealth of Virginia because of what happened. We have new processes in place to make sure that we remain in compliance. I think they can rest assured that under the watchful eye of the Office of the Inspector General, we are doing everything that we can to remain in compliance.
413 News Now, I'm Evan Watson reporting. Wait, hold up. Before we got here, we had to buy a bundle of mystery boxes. So let's start from the beginning.
We just got outbid.
Here we are bidding on an online auction for a 300-pound pallet of something. Estimated retail value at $3,000.
And outbid again.
I'm sweating a little bit, trying to buy a pallet based on one picture of plastic-wrapped boxes.
And ding ding, we have a pallet of general merchandise. It couldn't be more vague.
A $500 bid plus $400 more in shipping costs to move it from Las Vegas to Norfolk. 1 week later, it arrived. I rolled it into our garage with photographer Stephen Wozniak. Then we started the fun unboxing. I pulled out a blender, then some power tools. We found 2 air fryers and unmarked boxes, a couple of other kitchen items too. I opened one of the boxes labeled Shrimp Supreme Dumplings very cautiously, but felt relieved to find just a vacuum sealer. Then we arrived at the big items. I pulled out a tankless water heater, something I never expected to find. Next up, a huge countertop convection oven.
That is very heavy.
Then at the bottom of the pile, I found 2 large boxes and I knew we had something fun. We pulled out 2 electric scooters. After a few minutes, we put them together and they ran correctly. At this point, we realized we would need to test out most of the electrical items, so we packed up, and then the next day we brought the haul to my desk in the newsroom. I started looking up the items online, seeing how much they're worth. Just one of the scooters retails for more than $300, so I started thinking we could make a profit. We even took our blenders and juicers to the kitchen, looked in the fridge, and found some free-for-all items.
This action?
And the blenders all worked as intended. My desk quickly turned into a staging area for product testing. The convection oven turned on and heated up. Our new DVD Blu-ray player worked too. There were a few duds. A food processor was broken and looked unusable. One of the blenders that worked in the kitchen was also cracked. And that massive tankless water heater, it was no longer being manufactured or sold online. After looking up every item and removing the broken ones, the combined prices for the new versions of the items in our bundle added up to $1,830. We bought the pallet for about $1,000, including shipping. So is this gamble worth it? Well, it depends on your ability to resell items, repair some, and sell some for parts. In a few cases, like with one of our sold-out electric scooters, these returned packages can include valuable finds. 13 News Now decided to donate the usable items to charity for the holidays, and I retired from online mystery pallet auctions. For 13 News Now, I'm Evan Watson, reporting.
Still following the decision out of Elizabeth City, no charges against the deputies who opened fire on Andrew Brown Jr. almost a month ago. Evan Watson was at the news conference.
All right, Evan, a lot of information coming out of that conference. You're breaking it all down for us. What can you tell us?
Yeah, well, first off, the big decision, as Dan said, that no charges are filed. District Attorney Andrew Womble said that Brown drove recklessly and dangerously directly toward the officers, calling it a reasonable call for the use of deadly force. He also said, and looking at this, that Brown was a threat to officers as soon as he backed up his car when he was in the driveway, and it didn't even need to get to the point of driving toward the officers, which was Womble's opinion of the videos when he saw it there. Also, looking at the body camera videos, which District Attorney Andrew Womble showed today, there's some up to interpretation, if you will, of what happened, because as Brown was driving forward, he was turning away and a deputy was trying to get out of the way. So Womble's interpretation being that it was justified, this shooting and the killing of Andrew Brown here.
Okay, Evan, I'm also curious, you referenced those videos. We did get to see some clips for the first time as media, as the public. Do we know how he was able to release those videos today? Did he get a court order to release those?
It's a great question, Dan. I asked him directly, did you get a court order? And he said no. And I asked him, isn't that in violation of the North Carolina statute, which requires both a petition and a public hearing? And District Attorney Andrew Womble said that he is not the custodian of the record. He is releasing these after getting the videos from the custodian of the record, and so he would not be in violation. It's something I have to look a little bit deeper into, but it was surprising to see him make the call, and it was a question a lot of people were trying to ask today.
You know, Evan, another question that you brought up was about Pasquotank County Sheriff's Office having this use of force policy for moving vehicles. I wanted you to tell us a little bit more about what that policy is, why you brought that up, and what was the response to your question as to the significance of that policy in this investigation.
So it comes down to the roles here. Womble's role here is to decide on charges, and he decided against charges for the deputies and whether it's justified. But when you look at that use of force policy for the sheriff's office, it says that shooting at moving vehicles is rarely effective, and said deputies, when feasible, quote, should take reasonable steps to move away instead of firing. I asked Womble, did this play a role in his decision today? He said he's aware of the policy, and no, it did not. So what I took from that to mean is that he decided that charges weren't likely to be filed, or charges shouldn't be filed in this case, and that any break of policy for the deputies involved, that would come down to the sheriff and the decision within the office there.
Evan, have we heard from the Brown family today, and do we know if they were given any advance warning as to the DA's decision?
We have not heard from the Brown family today, and the DA said that he did not tell the Brown family about this decision before announcing it at this press conference in the public safety building behind me just within the last hour or so. He did say later on in the news conference that he regretted the relationship between his office and the family and the attorneys, and that he could have done more to work on that over this process, but he laid out his reasons why he felt trust was broken. We've heard from the family attorneys why they thought trust was broken, calling for the recusal of Womble, which he did not do, but they were not given a heads up, according to Womble, and what he said today.
All right, Evan, thank you for that reporting. There is still a lot coming out of Elizabeth City. We will continue to follow this on air and online for you. Our continuing coverage of this breaking news in Elizabeth City.
The Virginia Department of Health has two ways of tracking numbers. The first is through school self-reports. These are submitted to the state within 30 days of the start of the school year. Students who are fully immunized, exempt, or have at least one dose of every vaccine are counted as compliant. Compliance rates hover around 93 to 96% for kindergartners and sixth graders. But health department officials use a second method to figure out how many students are actually immunized, a statistical technique called the Virginia Annual Immunization Survey.
Because it's not self-report and because it's a little bit more statistically sound, we think that that's a more reliable indicator of our immunization data.
This survey paints a different picture. Take sixth grade results since 2012. The compliance rate dropped from 93 to 82%, a concerning trend. Say you have a state that's 60% blue, and you need to separate the state into 5 districts. The ideal solution would be to draw 5 boxes that match voter representation. But say the blue party is in control of the process. It could draw 5 districts that completely disenfranchise all red voters. Or say the red party has the power. It could draw the lines to give the red party an advantage, even though there are fewer red voters. In the last 2 examples, the power of your vote is affected. Districts are packed and cracked based on political affiliation and often race and ethnicity. Elected officials are essentially picking their voters and not the other way around.